Hey there, everybody. It's Dr. Steve here with Kineci, and this is your part 3 of Understanding Your Pain, where we're talking about plantar fasciitis. So in part 1, we did some education and we did an initial ankle mobility exercise. In part 2, we went into the hip and the ankle combined, doing the mobility for the hip flexor and the ankle complex together. So now we're going to go into this third move, which is a seated nerve glide. So in the education piece in part 1, we talked about how the sciatic nerve running down the back of the leg feeds the bottom of the foot, and that can be a part of persistent issues. So what we're going to do is use a chair and we're going to have the painful leg out in front. This is a-okay to do on both sides, but it's of course more important to do it on the side that's involved, the one that's bugging you. But what you're going to do is sit at the edge of the chair, nice and tall, the leg out in front with the heel down and the toes up. And then the rhyme is the nose follows the toes. And so we're doing this up and down motion with the head and the foot. And as we tip down, we're putting tension on the nervous system from above, slack on the nerve from below. And then as we bring the toes up and the head up, now we're creating tension on the nerve from below and slack on the nervous system from above. So as we go back and forth with the nose follows toes, we're creating this gliding and sliding kind of motion of the nerve in the pathway. So that helps keep the nerve happy and healthy by feeding it nutrition and nutrients and oxygen and helping to move some of the metabolic waste out of the area so it's not so irritating to the nerve. But we need the nerves to glide and slide in their little pathway, and if they're hung up, they can be producing some of the pain and restriction that you're experiencing at the bottom of the foot. So seated nerve gliding is your part 3. Be sure to work through all of these different moves, and if you or anybody that you know are dealing with a plantar fasciitis, be sure to send them in and let's figure it out and help them find a plan moving forward. So until then, I'll see you. Bye-bye. Keep moving, everybody.